Yeah.
Okay. Thank you very much. I'm here with Dr. Birkmeyer, and I've contacted you to discuss about the role of hydrogen gas in L-Dopa and in dopamine, specifically for Parkinson's. So just to give a brief background, we're using the hydroxy gas machines on Parkinson's patients. We're doing a PhD with the University of Kent, because when we gave the gas to, which is mixed hydrogen oxygen gas, to patients with Parkinson's disease, we observed very interesting results in that the symptoms and tremors would disappear for a short period of time, up until an hour and a half to 3 hours after they stopped breathing the gas. So our experiments where we gave hydrogen oxygen mixed gas to Parkinson's patients who have persistent tremors or occasional tremors, muscle stiffness and other symptoms. We gave them the hydroxy gas, and we noticed the tremors stopped in nearly all the cases that we did. Then I discovered the paper in 2018, the Japanese paper that measures, quantifies the hydrogen producing bacteria in the gut, and found that those bacteria were specifically low or dysregulated in Parkinson's disease. From then on, I went to look at actually the chemical structure of dopamine and found it contained a lot of hydrogen. But I wanted to understand more about what we know about the mechanism and what relationship there is between dopamine and hydrogen. And I asked my good friend, who is Clive DeCarl, who interviewed you about NADH, and you mentioned some interesting things about that, and your background with your father and L-Dopa. Can you give us any insight that could help us to understand more about what is this relationship that we've discovered?
You mean the relationship between your hydroxy gas and dopamine? I can only speculate then on that. I mean, as you said, L-Dopa has a lot of hydrogen, you know, whereas dopamine is a metabolized decarboxylated L-Dopa. And the clue is that only L-Dopa passes the blood-brain barrier, whereas dopamine does not. So the clue was that the L-Dopa penetrates into the brain. There it's metabolized, and dopamine does the trick. Dopamine is a neurotransmitter which is responsible, you know, for movement, mobility, and even for, you know, cognitive performance. It's some sort of pleasure hormone, you know. The drug addicts, you know, have a high level of dopamine. I don't know what the relation to your hydroxy gas is. By the way, I was very impressed by the videos I saw about the application of your, you know, hydroxy gas, but I have no clue how the mechanism is, you know. Have you any idea on that? I mean, it's very similar, I guess, to our NADH. NADH is, for me, the biological form of hydrogen. We know that NADH passes the blood-brain barrier. In between 15 minutes, we can measure an increase of NADH in the cortex, in the brain. And there it does, you know, beneficial effects on Parkinson, but actually on all people, from healthy individuals, from Olympic athletes to Alzheimer's disease. We have performed a double-blind study, FDA approved at Georgetown University, seeing an improvement in certain cognitive function with NADH. And by the way, NADH is the first and only substance which leads to an improvement of Alzheimer's, whereas all the other drugs on the market only reduce the progression, or the, you know, retard the progression. But I was thinking, after seeing your videos, again, most impressive, what the hydroxy gas could do in the, obviously it's absorbed, you know, because it's applied nasally, and from the nose, it goes directly to the foramen into the brain, into the forebrain. The central, or the center for Parkinson's disease, however, is in the basal ganglia, in the so-called substantia nigra, the blackest substance. And the black substance is reduced by more than or degenerated by more than 50% before the first symptoms of Parkinson became apparent. That's a great disadvantage. So the earlier we can diagnose, the better it's off. But again, I wish I could help you to explain the potential mechanism. To a certain extent, or theoretically, NADH and hydroxy gas are similar, at least in the effect, you know. But how we can improve all of, I mean, from our side, we are in good shape because NADH you can take every minute, and you can measure even the effect after 15 minutes. So cognitive and also physically. Your hydroxy gas does the same. But the question is, how often can you apply the hydroxy gas without any side effects? And we have to work on that and see, have you done any metabolic examination? What changes, or what happens if you do that in the brain of rats, for example? And then, or have you done any MRI to see there is more oxygen? I guess that your hydroxy gas will attract and will, you know, bind oxygen, and oxygen is the clue for energy production. Yeah? We know that if we give, you know, patients NADH, they need a lot of oxygen. They, you know, they have a deeper breath, etc. So NADH is what we call the biological hydrogen. It reacts with oxygen to produce water and ATP. And we have seen that and then demonstrated in many patients, as well as in Olympic athletes, you know, when they can perform 15 to 20% better. And the study we have done, we took biopsies, muscle biopsies from the athlete. And after 1 month of NADH, they have 15 to 20% more ATP in their muscles. You know what that for an Olympic athlete means? This is the world, you know. So we have really performed a lot of studies. To give you another example, if you incubate heart cells with NADH, according to the biochemical dogma, nothing should happen. However, after 30 minutes, we find an increase of 30% ATP inside the heart cells. On the other hand, the oxidized form of NADH, NAD+, has no effect whatsoever because it does not penetrate the skin, the cell. NAD+ is an oxidized and a loaded and charged molecule, so it cannot penetrate a lipid membrane. This is I mean, there is a lot of noise that NAD+ is the best anti-aging. This is all nonsense. We have seen that the heart cells, when you incubate them with NADH, they live twice as long as without. So this is a clear scientific proven anti-aging effect. But again, I mean, I'm fascinating about your observation with the hydroxy gas. And the question is, how can we elucidate this mechanism further? Because that might be an even, you know, at least the same approach as we do with the NADH. I mean, yours gas, your hydroxy, and our is a chemical substance carrying the hydrogen. You know, and in biology, the carrier of hydrogen is nicotinamide, adenine dinucleotide. Normally, hydrogen is oxidized instantly, whereas in the molecule of NADH, it's partially stabilized. We succeeded some 20 years ago to stabilize NADH and to make an orally absorbable tablet of it. And that helped us a lot, and also to perform studies with. We have a study on chronic fatigue, as I said, you know, from Alzheimer to athletes. And chronic fatigue, then jet lag, sleep deprivation. We just recently performed a study on young students taking a cognitive performance test, which is available in all the computers, etc. And they did take a test. Then they took NADH, and half an hour, 30 minutes later, they repeated the test. Their performance increased by 35%, mental performance. There's no other substance in the world where you can get such an improvement in that short of time. Yeah, that's all I can say. The question is, yeah, I would be most interested to learn more about the mechanism of your hydroxy molecule. And it's a gas, and what happens if patients inhale that? I mean, I've seen a very impressive mitigation or release from tremor. But although we are working on Parkinson's disease since 61, as more than 60 years or almost 60 years, we have no clue where the tremor comes from. What is the mechanism basis of tremor? And tremor is for the patient the greatest concern, because everybody realizes I'm a Parkinson patient, and if you can avoid it or prevent it, you would be in absolutely good shape.
Yeah. Well, we've found a few facts, which are that we produce hydrogen gas through the bacteria in the colon. The main hydrogen producing bacteria is B. coccoides, Blautia coccoides, is the main bacteria making the most hydrogen gas of all the hydrogen producing bacteria. We know that this hydrogen gas production is dysregulated or low in Parkinson's patients. And then the next step is nearly all of my Parkinson's patients are taking Sinemet, which is a dopamine agonist.
Right. Yeah.
And I looked up the chemical structure of dopamine to find that it seems to contain hydrogen, oxygen, and nitrogen, but mostly hydrogen. So it stands to reason for me that if a patient is deficient in hydrogen gas production, they will become deficient in dopamine or L-Dopa and then dopamine. So this is why I wondered how the drug manufacturers actually make a tablet of dopamine. Do you know how dopamine tablets are made?
Well, dopamine tablets are not how shall I put it, not a great target. The pharma companies produce L-Dopa as a precursor of dopamine, and then can make tablets of it. I think it's synthetic from phenylalanine, and then either enzymatically or chemistry, they do the dihydroxy groups to the benzene ring, the 6 corner ring, and how they do it, I'm not quite sure, but it's enzymatically in huge columns, etc. I think many companies have a patent on that, but I make some notes that I find out, and I let you know then maybe by email. Your question is how L-Dopa is produced by the companies. Yeah, is it correct?
Yeah, and if it contains hydrogen, how is that synthesized into a tablet form? Is it something in the tablet that is creating hydrogen gas, like magnesium or something like that? This is why I'm wondering, because there's many ways hydrogen gas can be made. My other question was about why is it that Parkinson's patients need to have increased doses of this dopamine agonist? Because as far as I know, there is something about taking the drug which then reduces the body's capability to produce this naturally. Is that right? Or what is your understanding?
Let me correct you. Sinemet is not a dopamine agonist. Cinemed is the brand name for L-Dopa. So this is important. And the Cinemed, I don't know exactly how it's produced, but it's available as a tablet. And the more modern approach is Cinemed plus a decarboxylase inhibitor to inhibit the, the degradation of L-Dopa. How L-Dopa, Cinemed, is produced, I have no idea, but I can find out. I have some connection to Roche. Roche, Switzerland, is the biggest producer of Cinemed and Madopa, as it's called. Yeah. But
how did your father discover L-Dopa? Do you know?
Yes, an interesting, long story cut short. In Vienna, they were working on the brain of Parkinsonian patient, and they found out they had an L-Dopa and a dopamine deficiency in the brain. And then he tried dopamine, it didn't work. Then he tried L-Dopa, and all of a sudden he saw an improvement. And then it took some years to get the, this tablet into the market. And then he found out that when he add a decarboxylase inhibitor, which makes dopamine from L-Dopa, then he even could increase the effect against the opinion. If you block the degradation, you should have a decreased effect, but it was the other way around. And so I think the L-Dopa discovery was in 61, and in 65 they discovered the combination of L-Dopa and decarboxylase inhibitor. Interesting story, he collaborated with Roche, Switzerland, and the medical director, Dr. Pletcher, gave him the carboxylase inhibitor. And he said, well, this should diminish the effect. And as I already said, it improved the effect. And then after a couple of years, they found it blocks the degradation of L-Dopa in the organism, and therefore more L-Dopa gets into the brain, where then it's metabolized to dopamine. Yeah? So that was the critical step. The dopamine agonists are not that important, because the dopamine agonists do nothing but to sensitize the receptor, the dopamine receptor on the nerve cells. You make them more sensitive. But year-long experience, this is not the clue. And on the other hand, long-term treatment with dopamine does more harm than cure. After 10-year experience, they decline, because dopamine produces a lot of free radicals. Yeah? Because dopamine gets oxidized into topachrome. And my father saw a lot of patients from all over the world, particularly in the United States. They were all overdosed, and they were stiff and frozen. And then he asked me, you as a biochemist, you should think of something which could help these people. And I looked up the metabolic production of L-Dopa, and L-Dopa needs NADH for biosynthesis. And I did run one of the biggest medical laboratory in Vienna, and we had NADH on the shelves in quite huge amount. And I gave him one ampoule, and he was really brave and started applying it. And the first effect on a Parkinsonian patient was really impressive. I can send you the YouTube link that, and you can look it up. And that was the beginning of the NADH research. And we had only infusion at the beginning, because NADH is very unstable. My late father said, look, now you have to make me a tablet. We tried to make a tablet with the most common film, with lactose, milk sugar. We pressed compressed tablets, NADH plus lactose. After 4 weeks in the fridge, all NADH was oxidized. So it took us more than 5 years to find a filler as well as a stabilizer. And for those, formulation, we got patents. And now we have a tablet which is stable for at least 3 years. And it complies with the status of a drug. And we applied also for an Alzheimer drug in the United States, but it was declined because I don't want to go into that, but there is a lobby which, to give you an example, the Bristol Myers Squibb, which was quite a big, I think they merged now, but a big company, and the marketing director approached me and said, we want your NADH in our portfolio. Should send us the entire documents. I did that. After 6 months, I didn't hear back, and then I called him, and I had to learn if Bristol Myers Squibb would take NADH in their portfolio, 50% of their products would become obsolete, and this is quite a big business. So we are now selling it as a food supplement, but it's the one and only food supplement with more than 60 scientific studies. And I'm interested in any approach which, improves the dopamine level in the brain, as well as, adrenaline. It's related, and also serotonin. These are the most important neurotransmitter. But from my understanding, Mark, your gas is a hydrogen gas, not a hydroxy gas.
Well, yeah, let me explain this. There are machines that give you hydrogen gas only for breathing. However, these machines make people hypoxic because the hydrogen gas is displacing oxygen. So, but with the hydroxy gas, which is 2/3 hydrogen, 1/3 oxygen, it's the split of water as H2O into mixed hydrogen oxygen. Then we found that people can breathe this gas continually without becoming oxygen deficient, unless they have, for example, COPD, where their body is used to a low oxygen saturation. Suddenly they get, when we put the pulse oxygen on the finger and we see them increase over 2 hours of breathing, but they get lightheaded because it's a bit like you're hyperventilating, same effect. Suddenly their body gets a high oxygen saturation and they're not used to this. So people with the COPD have to start slowly and they rise up over time, the consumption. But here's where we are now. I've got many patients with the Parkinson's, 50 or 60 patients who are using the machine every day, some of them every 3 hours, because it stops the effect of the tremors. So after they desaturate from the hydroxy gas, they will start tremors again. They breathe some more gas and it goes away again. So my theory is that if we take a culture of hydrogen producing bacteria like Blautia coccoides, being the one that produces by far the most, B. coccoides, and you culture this into, and then insert from south to north by renal catheter, whether this will be something that could get the hydrogen back into the colon so that they don't need the machine every 3 hours. They're making enough gas in the gut.
I can understand. By the way, my question is, how can you separate hydrogen from oxygen? Are there 2 tubes which the patient gets?
No, there's different machines to make mixed hydrogen oxygen. So our machine we are using has anode and cathode, and it has water, pure water in there, and it has an electrolyte, which is sodium hydroxide, a lye. This is the electrolyte to provide the conductivity between the plates. The hydrogen goes to the anode and the oxygen goes to the cathode, but they rise up. A new gas is created in the middle of the reaction, which is, we call it electrically expanded water. It's a cluster of these negative electrons. Now, there are machines that use no electrolyte. They have something called a PEM, or a proton exchange membrane, in which case this is providing the conductivity. Only there is pure water inside the reactor. Then you can make the hydrogen oxygen separately and recombine it later. But the reason we don't do that is because we found that with the hydroxy gas, with the Brown's gas way, with electrolyte, nothing in the middle, the PEM in the middle is stopping the reaction occur for the electrically expanded water.
Yeah.
And that's why we're using this method. Also, you can't breathe hydrogen gas on its own. You have to breathe hydroxy gas. It's making
Yeah. So hydroxy gas is the term for hydrogen as well as oxygen, but not, because hydroxy is OH also, it's already combined. It's fascinating that the hydrogen and the oxygen does not react with each other, like a rocket fuel, for example. I mean, and again, I'm learning that you cannot breathe, or you should not breathe hydrogen gas for a long period of time. Why?
It's displacing oxygen and making people hypoxic and breathless.
Oxygen deficiency then.
But obviously now they can still breathe only hydrogen gas, but not for a long time. So there, it limits the treatment potential for it. The mixed hydrogen-oxygen gas, in 2/3 hydrogen, 1/3 oxygen, we found that people can breathe even all day, all night. So, my last question, because I think we only have 4 minutes left before we can finish. But my last question is, what our theory about getting a bacteria making hydrogen and inserting it through renal catheter into the colon 40 centimeters up.
Right.
Well, do you think that will work?
Well, it's a good question. I have no answer. You have the bacteria in the gut, and you want to have a connection to the kidney or to the brain or wherever.
Well, I'm thinking that if Parkinson's are deficient in the hydrogen gas, they're not making enough liters of gas.
Right.
If L-Dopa and dopamine needs hydrogen to form, then obviously the source of the hydrogen can only be the gut.
Right.
So, and the thing making the hydrogen is the bacteria. And we know from the Japanese studies that there's a deficiency in this bacteria. In fact, many of my Parkinson's patients tell me this started happening after antibiotics, taking too many antibiotics or something like that. So this is damaging gut. A lot of my Parkinson's patients are alcoholics, and they're drinking alcohol, which is killing bacteria in the gut.
You have certainly tried to freeze dry the bacteria and give it as freeze-dried material to the patient. You need a protection against the acid condition of the gastric juice. But I mean, there's a product called Omnibiotic. If you have a disturbed gut system or infection, then it will mitigate. My idea is try to get the bacteria, the hydrogen-producing bacteria, in the dry form, in capsules, protected as film-coated capsules to protect from the gastric juice, and then try and give it to Parkinsonian patient. And if they produce hydrogen, the hydrogen is absorbed from the intestinal mucosa, as we see it for NADH as well. I think that might be an idea. And again, hydrogen is in any sense effective, whether it's in the gut or in the liver, or even in the blood. And that's a very simple approach. I mean, you can cultivate this bacteria or even buy it from somewhere and have it lyophilized, and then pour it into capsules very easily. There are a small manual machine which you can fill the capsules, and then to try it, and maybe you can make a very simple placebo control, make capsules without, and that would do the trick. And see, I think the idea with the hydrogen producing bacteria, I didn't know that before I get your message, so let's try. I mean, we did the same with the NADH, because NADH is instantly destroyed in the gastric juice. And our first capsules were destroyed, and we were really disappointed. But then my knowledge in biochemistry said, well, the gastric juice is so acid that it destroys NADH instantly in 10 seconds. And I would be most interesting to.
Because you're thinking north to south, but I was thinking south to north.
What do you mean? yeah, I don't know what you mean. You produce hydrogen in the gut, and then it goes up into the lung.
Well,
Yeah.
yeah.
Yeah, I mean,
no, I'm thinking rather than give the bacteria in a capsule to swallow, actually through the anus renal catheter to put it in exactly in the colon where we want it to be, where it's normally producing the gas in the colon.
Yeah, but this is, I mean, from the application point of view, it's not too practical. The capsule could be simpler, but you can do both. You know?
Yeah, you can do both. My last question: Will you help me do this then? Work on this to develop this?
Sure. As long as my times allow, you know, I'm not unemployed. I'm running a company, but again, my main focus is always research. You know, to push the border of medicine and to help people. You know, because I've seen so many suffering. No, we can try. I mean, try. I will. If you get me the bacteria, I can send you capsules and the capsule machine, but that's easy to get. And then you get the lyophilized bacteria, you put it into the capsules, and then you have it film coated, or they even capsules they are already film coated, and then try it. And with your nasal tube, yeah, I mean, it's another approach, you know, but the patient are more prone for capsules than for nasal tube. That's for sure. But
yeah,
you should try these two approaches, or even another approach. You know, for maybe yeah. I don't know. I have to look into it. I would appreciate if you can give me some more information about the bacteria. Yeah. And then I can line out my ideas and mail it to you, and you say yes, and then we start collaboration.
Okay, yeah. Brilliant. That's fantastic. I will thank you very much for this meeting. And I'm sure I would love to work with you on this actually, because I think this is the way to permanently affect the symptoms as opposed to people on the machine every 3 hours, which is also...
At the end, I have to point out your idea is well taken, and even if you succeed, you have a lot of animals in the pharma industry. I can assure you, you know, unless you sell it to some of them. Fine, Mark.
Okay.
Take care, stay well.
Thank you, Dr. Birkmeyer. Appreciate that.
And you will contact me, yeah?
Will do. Okay.
Yeah.
Thank you so much. Take care. Bye.